Good morning. I am Dr. Ejike Onyebo Samuel. I'm a senior registrar in the Department of Anatomic Pathology, Alex Ekweme, Federal Teaching Hospital, Abakaliki, Ebonyi State, Nigeria. I have been asked to make this short video on what pathology is and also to x-ray on my personal experiences in practice. I must say I'm doing this video with pleasure and I thank you for the opportunity given me. To this end, I say welcome on board to the medical students and younger colleagues who are considering or who may consider a career path in this area. Pathology, otherwise called laboratory medicine, is the branch of medicine that deals with examination of bodily tissue for the purposes of diagnosis, teaching and learning, or forensics. Pathology as a department has subdivisions or units that operate in tandem and simultaneously to achieve one aim, which is to bring out a correct report or results in a timely manner such that it will have clinical significance, informing the clinicians of the particular diagnosis for every disease case that is presented by the patient. In the department, structure-wise, we have the fine needle aspiration cytology, which is run as a clinic in some centers. Here, the FNACs of every mass on the patient's body is obtained and a slide prepared and diagnosis made. Also, histopathology proper is another unit where tissues or tumors obtained from patients are sent to the lab. They undergo surgical cut-up or grossing. Slides are prepared, read, and impressions or diagnosis made and transferred in the form of reports to the clinicians. Another unit that is of great importance is the autopsy practice. Because of the fact that the dead teach the living, this is a pivotal or important aspect of pathology practice, because for every case the clinicians lose in the clinic or in the wards, the pathologist finds the answer on the autopsy table. Autopsy practice enables hands-on training of medical students and junior residents, even senior residents, on how to bring out information that will improve the clinical skills and decisions of doctors. So, in a nutshell, you see that whatever pathology is doing is to bring out the meat of every disease condition that might have skipped only clinical examination. So one would ask, are there requisite skills that a doctor wishing to pursue a career in this area must have? Yes, there are. And this includes, one, you must have an analytical mind. You must have a mind that doesn't accept anything. For everything, you must ask the question, why? Why is this happening? Why is this so? Why should it happen? Every piece of information must pass through your distillation crucible. You must analyze it critically. Another skill you must develop is pattern recognition. Another skill is perfect hand-eye-mind coordination. In the autopsy table, there must be you must have a perfect hand-eye coordination. During the surgical sign out of slides, you must have a good and perfect hand-eye-mind coordination. Another skill, so to say, is discipline. You must be disciplined. You must be disciplined. You must love learning. You must love studying. You must sit down for hours to study. Because as a pathologist, you must study more than your colleagues in the clinic for you to provide answers for what they don't know. If your colleagues in the clinic know as much as you know, then you lose your relevance. So the pathologist must always know more than the colleagues in the clinics so that you'll be relevant in the hospital. Then you must have passion for what you are doing. You must love what you are doing. Practicing pathology or being trained as a pathologist, you must be something you fall in love with. So for our junior colleagues wishing for a career path in this area, I would advise that you have a goal that you break down into plans. Put attainable deadlines to these plans so that they can transform into a reality. I wish you well and I hope you succeed in this area as you've chosen to know. Bye-bye.